Asthma is a fairly common disease amongst our population. According to statistics, 5% of the population suffers from asthma. Whether it is due to a genetic predisposition or just an allergy, those who suffer from asthma attacks have a huge risk for their health. So, what is really asthma and what can we do to change and help this? We came here to the surgical unit to discover about this disease. In the surgical unit, we spoke to Dr. Elizabeth Fitzroy, a cardiothoracic surgeon with a PhD in obstructive pulmonary diseases.
Asthma is a respiratory disease. Now, all the respiratory system is inside this cavity, the thoracic cavity, and we can find the sternum, the ribs, the vertebra. Now, inside this cavity, surrounded by bones, we have all this content. We can find the heart, the lungs, the trachea that comes here. Now, when we have asthma, the bronchia gets inflamed. Now, if I put out half of the lung, we're cutting it, and I remove the heart, behind the heart, we can find the bronchia. This is the trachea, and the trachea gives us the two principal bronchia.
And this is where the disease occurs.
Exactly, this is where asthma occurs. In these bronchias, when we have asthma, they get inflamed, and that causes difficulty breathing and other symptoms.
So for those who are watching home, what is the thing that you explained about inflammation?
Okay, so as I have said, when we have asthma, the principal bronchia, which are here, inflamed. Now, this inflammation in a tube, because the bronchia are a tube, if the tube gets inflamed, the diameter in this tube is reduced. So the air has more difficulties going through the bronchia. There are two types of asthma, the allergic asthma and the non-allergic asthma. Now, the allergic asthma is triggered by an allergen, something that gives you allergies and makes the immune system work when it shouldn't be working. Now, the non-allergic asthma can be triggered by a cold, by dust and other sort of triggers.
This made the disease quite clear to me, but I still needed more answers. So I spoke with Dr. Claire Mackenzie, a family doctor specialist in asthma, and her patient Lucy Sloan, a possible sufferer.
Come in.
Hello.
Good morning.
Good morning.
I'm Dr. Mackenzie.
I'm Lucy.
Take a seat, please.
Thank you.
So, Lucy,
Yes.
how can I help you?
Well, I'm not feeling well.
Could you describe the main symptoms you have suffered?
Yes, of course. I've been coughing for a few days at night, and that makes me feel very uncomfortable because I hear like a coming out from my chest, and that doesn't let me sleep. And also a few weeks ago, I've got like a pain in my chest, but now it is more like a pressure, not a pain. And I also have something that I thought it was psychological because I had a lot of exams and I had a little bit of anxiety, but I feel like if I had a difficulty when I breathe. I don't know if it's normal or...
Okay, we'll see. And how long have you been with these symptoms? When did it start?
Like 4 days ago, but the pain, it was 2 weeks ago. Now it's more, the thing why I am here is because the symptoms that started 4 days ago.
Okay. Okay, so I am going to explore you.
Okay, do I have to take my jacket off?
Yes, please take it off.
After Lucy's description, Dr. Mackenzie decided she needed to explore her, and she came to her own conclusion.
I want to hear if there are whistles coming out of their chest, because that's a symptom of asthma. I may come to the conclusion that you suffer from a disease called asthma because I have been able to hear you whistles in your chest. But to confirm the diagnosis, I am going to make you some personal questions if you don't mind. Okay? So, Lucy, Is there any family member who suffers from asthma?
Well, now that you talk about it, I remember that my father, when I was little, suffered from asthma during the springtime. I think it was because allergy, and I used to help him with his attacks while they were at home,
Okay,
but I don't think there is.
only your father.
Yes.
Okay, so there is a genetic predisposition to suffer from asthma because there is a probability that 1 to 5 children will develop asthma if one of their parents suffers it. Okay?
Mhm.
So, Lucy, do you smoke?
I started smoking at the age of 15, and some years later, when I was 18 years old, I found out how dangerous could be smoking for my health, and I tried to quit it at all. Now it is more or less 8 months since I am trying it, and I feel a lot better. Whereas I occasionally smoke one cigarette when I hang out with my friends.
Okay.
So smoking is bad for asthma.
Yes, tobacco is one of the main aggravating factors of asthma. Patients with asthma cannot smoke cigarettes because that decreases the response to the inhaled corticosteroids, that it's the treatment to these patients. Also, the smoke of cigarettes increases the inflammation of the bronchi, so it's not recommended to smoke when you have asthma. Do you have persistent cough at night or while you are doing an effort, such as sport?
Definitely, I have persistent cough during the night that doesn't let me sleep. I go to the gym 3 times a week and nothing happens to me while I am there. It is true I didn't go to the gym when I felt the pain in my chest because I was afraid something happened to me there, but I cough repeatedly at night and only spontaneously in the gym.
Okay, so you have clearly symptoms of a patient of asthma because that are the clearly symptoms of a cough of an asthmatic patient. So, are you allergic to something?
Well, as long as my father had a lot of allergies during the springtime, the doctors had always recommended me to take an allergies test. So I decided to ask for one a few years ago, although I didn't have any symptom apart from mucus and ETIs, and I had the same allergies as him. I can remember the most important ones: grass and pollen. But I didn't take them very seriously because they had not affected me too much until now.
Okay, so you should avoid the exposure to the factors that aggravate your asthma. And after having explored you and listened to you, I confirmed the diagnosis that I had already made while I was exploring you, that I could hear you wheezing. So yes, you suffer from asthma.
After Lucy's diagnosis, Dr. Mackenzie prescribed a treatment for her asthma and called nurse Caroline Simpson to explain how to take it.
I'm going to explain you how to use 2 medications to treat asthma, which are anti-inflammatories and bronchodilator. Do you know something about them?
No.
Okay, so bronchodilator are used to reduce the inflammation of mucous membrane. It is administered by inhaler. Do you know how to use it?
No.
So what are bronchodilators used for?
They expand respiratory muscles and that expand respiratory tract. So they can be administered in 2 ways: oral, which consists of taking a pill, or by inhaler. In my opinion, inhaler is better. Take the tap off, put it on your mouth, press the inhaler down, inhale from 3 to 5 seconds, hold your breath for 10 seconds, and then you will repeat it 2 times, okay? Do you have any tap?
No.
This one you use it every day, and this one only when you are suffer an asthma attack, which is when you are coughing.
Lucy was able to discover how to manage her disorder, but many individuals, especially children, find it hard to control. Liz Atwood, founder and director of Asthma Life, explains.
Children with asthma are more prone to take antibiotics unnecessary than other kids. It's because doctors confuse asthma with other infection of respiratory system. Because of this tendency, there was an increase in drug-resistant infections.
So the best way to make
people aware is through education, and you said you were starting an education plan with schools, am I right?
Yes, schools should be given an action plan in case one of the kids suffer an episode of asthma. And this plan has to include a phone to contact with, information about the symptoms and the causes, and also the treatment and how to use it. And also a problem is that some kinds of asthma are caused by exercise, and parents who talk with PE teacher to make sure that he knows, or she, the action plan, and that he knows also that his kid can do the same effort as the rest of the